Assalamu alaikum. Our lecture today is about inflammation, presented to you by Dr. Rasha As-Safi. The objectives of this study: the mechanism of acute inflammation, chemical and cellular mediator of inflammation, the sequence of events in acute inflammation, morphological pattern of acute inflammation, and the systemic effect of inflammation. The inflammation is the response of the vascularized tissue to infections and tissue damage that brings cells and molecules of host defense from the circulation to the site where they are needed. The goal is to eliminate the offending agent. Usually it is a protective response essential for the survival of our body, and it's served to rid the host of both the initial cause of cell injury, whether it is microbe or toxin, and the consequence of the injury as the necrotic cell and tissue. The mediator of defense include phagocytic leukocyte, يعني الخلايا اللي هي included in inflammation, antibodies also, and complement protein. All these are included in the process of inflammation. Most of these normally circulate in the blood where they are sequestrated, so they cannot damage the normal tissue, but can be rapidly recruited to any site in the body when they are needed. The process of inflammation delivers the leukocyte and the protein to the foreign invader, such as the microbe, and to damage or necrotic tissue, and to the damaged or necrotic tissue, and it activates the recruited cell and molecules, which then function to eliminate the harmful or unwanted substance. This is the summary of the inflammatory process. The typical inflammatory reaction develops through a series of sequential steps. What are the steps of inflammation? Number one, the offending agent, which is located in the extravascular tissue, is recognized by the host cell and molecule. Number two, leukocytes and plasma protein are recruited from the circulation to the site where the offending agent is located. And number three, the leukocytes and protein are activated and work together to destroy and eliminate the offending substance. This reaction is controlled, should be controlled and terminated. It should not be continuous. The damaged tissue is repaired. These are the series of steps of inflammation. The inflammation is of two types: either it is acute and chronic. The initial rapid response to infection and tissue damage is acute inflammation. What are the criteria of acute inflammation? Typically develop within minutes or hours and is of a short duration, lasting for several hours or few days, and its main character هو exudation of fluid and plasma protein اللي نسميها الإديمة, and the immigration of the leukocyte, mainly the neutrophil, because it is acute. When the acute inflammation achieves its desired goal, when it's achieved the goal of its occurrence, اللي هو eliminating the offender causing, the reaction subsides and residual injury is repaired. But if the initial response failed to clear the stimulus, so the reaction will progress to protracted type of inflammation that is called chronic inflammation. The chronic inflammation may follow acute inflammation or arise de novo, يعني originate from the beginning as a chronic inflammation, or it may follow the acute inflammation. It is of longer duration and associated with more tissue destruction, and the presence of lymphocyte or macrophage and proliferation of blood vessel and fibrosis are of its main criteria. هذا هنا عندنا الفيتشر of acute and chronic inflammation. طبعا مقارنة ما بين الأكيوت والكرونيك depending on the onset, cellular infiltration, the type of cell, tissue injury, and fibrosis, local and systemic signs. The inflammation is induced by chemical mediators that are produced by host cell in response to the injurious stimuli. Exudation, pus, transudate, and edema, these are some of definitions which are important to be known during the inflammation. Exudation is the escape of fluid, protein, and blood cell from the vascular system into the interstitial tissue. من الفاسكولار space إلى التشيو. An exudate هو عبارة عن extra vascular fluid اللي هو rich in protein of high protein concentration and specific gravity above 1.02. It involves significant alteration in the normal permeability of the small blood vessels in the area of injury. يعني رح يصير عندنا زيادة in the permeability of a small blood vessel wall. This increased permeability is due to the loosening of the tight junction in between the adjacent cell. So there will be a gap formation in between the cells, neighboring cells. This gap permits a high protein molecule and high molecular weight particles to pass from the intravascular space to the extravascular space. Okay. The pus or purulent exudate هو عبارة عن inflammatory exudate rich in leukocyte. يعني نقصد بها mostly neutrophil, the debris of the dead cell, and in many cases microbes, واللي هي تسوي لنا الباس نسميها pyogenic bacteria. الترانزودate, it is a fluid with low protein content. It is the يعني عكس exudation and specific gravity less than 1.012. It results from osmotic or hydrostatic imbalance across the vessel wall without an increase in the vascular permeability. يعني ضغط الماء داخل الفاسكولار سبيس راح يكون أعلى من هو inside the tissue، فراح يحصل تناضح للمياه from the intravascular to the extravascular space without escaping of the protein particle. The edema denotes to an excess of fluid in the interstitial tissue or serous cavities, and it can be either an exudate or transudate. This is a schematic presentation for the normal state blood vessels circulation, and in the case of a transudate and the exudate. The external manifestation of inflammation, often called the cardinal signs of inflammation, these are heat, color نسميها in Latin, redness اللي هي rubber, swelling اللي هي tumor اللي احنا نقصد به حتى نطلق مصطلح التيومر على المalignancy because it is a swelling, pain, dolor, and loss of function اللي هي functio lisa. Okay. Although normally protective, but in some situations the inflammatory reaction become the cause of the disease itself, and the damage it produces is its dominant feature. Mainly هو inflammatory reaction اللي accompanied by local tissue damage and associated with signs and symptoms اللي هي pain and functional impairment. هذه هي اللي نقصد بها damaging effect. There are many diseases اللي هي in which the inflammatory reaction is misdirected. مثل عندنا against the self tissue بالautoimmune disease, in which autoantibody directed against the self antigen, the body start to attack itself or the own organ. It occurs against normally harmless environmental substance that evoke an immune response. مثلا allergies. يعني مثلا اكو بعض الاشخاص يتحسسون لبعض انواع من particles اللي هي normally not harmful. These are called allergies because it's evoke an inflammatory and allergic response to some persons, or is excessively prolonged. إذا كان inflammation is excessively prolonged راح يعطينا disease مثلا infection by microbes that resist eradication, resist antibiotic, resist treatment. What are the stimuli of acute inflammation? The stimuli of acute inflammation are many, like infection, trauma, tissue necrosis, foreign bodies, immune reactions. Acute inflammation has two major components, the vascular change and the cellular events. The vascular change include alteration in the vessel caliber resulting in the increased blood flow, which means vasodilation, and change in the vessel wall that permit plasma protein to leave the circulation, that's to say, increase vascular permeability. In addition, the endothelial cells are activated, resulting in increased adhesion of the leukocyte and migration of the leukocyte through the vessel wall. All these including the vascular changes. While the cellular events, immigration of the leukocyte from the circulation, and accumulation in the focus of injury, which is cellular recruitment. This should be followed by the activation of the leukocyte, enabling them to eliminate the offending agent. Changes in the vascular flow and caliber. Changes in the vascular flow and caliber begin early after injury and consist of the following. First of all, we have vasodilation. This is induced by the action of several mediators, mainly the histamine, on the vascular smooth muscle. It is important, one of the earliest manifestations of acute inflammation is the vasodilation and may be preceded by a transient vasoconstriction. Usually it involves the arterioles and then lead to the opening of a new capillary bed in the area. The result is increased blood flow, which is the cause of heat and redness, erythema at the site of inflammation. This is followed, the vasodilation rapidly is followed by increased permeability of the microcirculature with the outpouring of protein-rich fluid, which means the exudate into the extravascular tissue. The loss of fluid and increased permeability and thus increased vessel diameter, this leads to slower blood flow and concentration of the red cell in the small blood vessel. This will increase viscosity of the blood. These changes result in stasis of blood flow, engorgement of small vessels jammed with the slowly moving red cell, seen histologically as vascular congestion and externally as localized redness, erythema of the involved tissue. As stasis develops, so the blood leukocyte, mainly the neutrophil, accumulate along the vascular endothelium. At the same time, endothelial cells are activated by mediator produced at the site of infection and tissue damage and express increased level of adhesion molecule. So the leukocyte then will adhere to the endothelium, and soon afterward they migrate through the vascular wall into the interstitial tissue. Increased vascular permeability and decreased blood flow. Increased vascular permeability lead to escape of exudate into the extravascular tissue. We have several mechanisms have been proposed for increased vascular permeability, include formation of endothelial gaps in between the endothelial cell. This is occur in the venule due to endothelial cell contraction, junctional retraction, direct endothelial cell injury as by burn or infections, leukocyte-dependent injury due to accumulation of leukocyte and their activation product. So all these mechanisms are involved in the increased vascular permeability. We have the cellular event, اللي هي leukocyte recruitment and activation. The sequence of events in the recruitment of leukocyte from the vascular lumen to the extravascular space consists of: number 1, margination and rolling along the vessel wall; number 2, firm adhesion to the endothelium; 3, transmigration between the endothelial cell; 4, migration in the interstitial tissue toward the chemotactic stimulus. This is the figure represent how the cell can open in between, passing from gaps in between the endothelial cell from the bloodstream and intravascular space to the extravascular tissue. Leukocyte recruitment to the site of inflammation. Leukocytes that are recruited to the site of inflammation perform the key function of the eliminating the offending agent. The journey of leukocyte from the vessel lumen to the tissue is multi-step process that is mediated and controlled by adhesion molecule and cytokines. So leukocytes normally flow rapidly in the blood, and in the inflammation they have to be stopped and then brought to the offending agent or the site of tissue damage outside the vessel. So this process of how the leukocyte brought from the intravascular to the extravascular space is divided into phases consisting: number 1, First, of adhesion of the leukocyte to the endothelium. The leukocyte is passing axially, يعني in the central of the blood vessel, in the bloodstream and rapidly. So the leukocyte should adhere to the endothelium in order to be attached to the wall of the blood vessel, and then it will pass outside to the extravascular tissue. Then transmigration of the leukocyte through the vessel wall, then movement of the cell toward the offending agent. So different molecules play an important role in each step of these in order to complete the process. Leukocyte adhesion to the endothelium, this is the first step. So the red cell, being smaller, tend to move faster than large white cell. This is normally. As a result, the red cells are confined to the central axial column, and leukocytes are pushed out because they are bigger size, pushed out toward the wall of the vessel. But the rapid flow of the blood prevents the cell from attaching to the endothelium. All these are normal events. So the lighter red cell move in the center of the blood vessel wall, while the bigger and heavier leukocyte passing also axially but peripherally near the blood vessel wall. But the presence of endothelial cell prevent these leukocytes from being adherent to the vessel wall. This is normally. As the blood flow slow early during inflammation at the step of stasis, as we say, so the hemodynamic condition will be changed and more white cell will assume peripheral position because of stasis along the endothelial surface. This process of leukocyte redistribution نسميها margination. By moving close to the vessel wall, the leukocyte will be able to detect and react to changes in the endothelium. What will happen in the endothelium? If the endothelial cells are activated by cytokine and other mediator produced locally, so the endothelial cell will express adhesion molecule to which the leukocyte will attach loosely. بالبداية, the attachment of the leukocyte to the adhesive molecule on the endothelial cell is loose. These cells will bind and detach, يعني تلتصق وتنفصل, and thus being to tumble يعني تقفز on the تقفز وترجع تلتصق on the endothelial surface as the process نسميها rolling. The cell finally will come to rest, تجي تستقر على endothelial cell at some point where they adhere firmly at that moment. The attachment of the leukocyte to the endothelial cell is mediated by complementary adhesion molecule on the two cell type whose expression is enhanced by cytokines. Leukocyte adhesion to endothelium, we have two major families of molecules involved in leukocyte adhesion and migration are the selectin and integrin. Selectin mediate initial weak interaction between leukocyte and endothelium, and these are receptor expressed on leukocyte and endothelium. The three members of this family are E-selectin expressed on endothelial cell, P-selectin present on the platelet and endothelium, and L-selectin found on the surface of most leukocytes. The endothelial selectin are typically expressed at low level or not at all on the unactivated endothelium and are upregulated after stimulation by cytokines and other mediators. Therefore, binding of leukocyte is largely restricted to the endothelium at the site of infection or tissue injury. Leukocytes express L-selectin at the tip of their microvilli and also express ligand for E and P-selectin, all of which bind to the complementary molecule on the endothelial cell. These are low affinity interactions with a fast off rate, and they are easily disrupted by the flowing blood. As a result, the bound leukocyte will bind and detach again, and thus begin to rolling out along the endothelial surface, and these are weak selectin mediated rolling interaction. Slow down the leukocyte and give them the opportunity to recognize additional adhesion molecule on the endothelium. The firm adhesion of leukocyte to endothelium mediated by family of leukocyte surface protein called integrins. Integrins, these are transmembrane glycoprotein that mediate adhesion of leukocyte to endothelium and various cells to the extracellular matrix. They are normally expressed on leukocyte in low affinity form, and they are not adhere to their specific ligand until the leukocyte being activated. Activation of the leukocyte is by the chemokines, which are chemoattractant cytokines that are secreted by many cells. They bind to endothelial cell and are displayed at high concentration on the endothelial surface. When ruling leukocyte encounter the displaced chemokine, these cells are activated and their integrin undergo conformational changes and cluster together and converting to a high affinity form. At the same time, other cytokines like interleukin-1, tumor necrosis factor also activate the endothelial cell to increase the expression of ligand for integrins. Combination of cytokine-induced expression of integrin ligands on the endothelium and increased affinity of integrin on the leukocyte, this will result in firm integrin-mediated binding of the leukocyte on the endothelium. Leukocyte migration through the endothelium. After being arrested on the endothelial surface, the leukocyte migrates through the vessel wall primarily by squeezing in between the cell at the intercellular junction. This extravasation of the leukocyte in semi-transmigration occur mainly in the post-capillary venules. Further movement of leukocyte is driven by chemokines produced in the extravascular tissue, which stimulate the leukocyte to travel along a chemical gradient. Platelet endothelial cell adhesion molecule اللي نسميها PCAM1 اللي هي نفسها نسميها CD31. This an adhesion molecule expressed on the leukocyte and endothelial cell and mediate the binding events needed for the leukocyte to traverse the endothelium. After traversing the endothelium, the leukocyte will pierce يعني تخترق the basement membrane, probably by the secreting collagenase اللي هي enzyme that digest the collagen of the endothelium underlying the endothelium, and they enter the extravascular tissue. After exciting the circulation, the leukocyte move in the tissue toward the site of injury by a process اللي نسميها chemotaxis, which is defined as a locomotion of the leukocyte along the chemical gradient of a chemotactic agent. Both exogenous and endogenous substances can act as a chemoattractant. يعني مواد اللي هي endogenous and exogenous ممكن أن تشتغل as a chemoattractant for the leukocyte. These including the bacterial product, cytokines, especially those of chemokine family, component of the complement system اللي هي C5a, part of the complement system, product of the lipoxygenase pathway of arachidonic acid metabolites, particularly leukotriene B4. These chemoattractants are produced by microbes and by host cell in response to infection and tissue damage and during immunological reaction. The net result is that leukocytes migrate toward the inflammatory stimulus in the direction of the locally produced chemoattractant. The nature of the leukocyte infiltrate varies with the age of the inflammatory response and the type of stimulus. In most forms of acute inflammation, the neutrophil predominate in the inflammatory infiltrate during the first 24 hours and are gradually replaced by monocyte-derived macrophage over 24 to 48 hours. This is a figure showing how the process of leukocyte transmigrate from the intravascular to the extravascular tissue or space. The nature of the leukocyte infiltrate the inflammatory reaction. Here we have the photomicrograph show an inflammatory reaction in the myocardium after ischemic necrosis or infarction. A represent early neutrophilic infiltration. تلاحظون هنا النيوتروفيل اللي هي النيوكلياي containing النيوكلياي اللي هي polymorph nuclear leukocyte، النيوكلياي مالتها مفصصة الخلايا تحتوي على نيوكلياي ثلاثية ورباعية اللي هي تمثل لنا النيوتروفيل infiltrating and congested blood vessel early early neutrophil invading with neutrophilic infiltration with the congested blood vessel within the congested blood vessel. B هنا راح نشوف there is a later on mononuclear cell infiltration. This is depend on the chronicity of the inflammatory infiltrate. How early the infiltration with the neutrophil and later on chronic infiltration with the mononuclear cell. C represent the approximate kinetics of the edema and cellular infiltration. بالبداية تبدي عندنا activity. This is x-axis representing the days, day 1, day 2, day 3, while the y-axis representing the activity of the cell and the events of the inflammation. During the first day, starting from the beginning, edema present due to vasodilation. Later on, there will be neutrophil accumulation and its peak within the first day, and during throughout the second day, the neutrophil infiltration start to decline and start to be appearing the peak of monocyte and macrophage starting to be appear in the field of the inflammatory infiltrate. Phagocytosis and the clearance of the offending agent. Recognition of the microbe or dead cell induces several responses in leukocyte that are collectively called leukocyte activation. After leukocyte, mainly neutrophil and monocyte, have been recruited to the site of infection or tissue injury, they must be activated to perform their function. Leukocyte activation results in the enhancement of the following function. Number 1, يعني بعد اللeukocyte activation اللي راح يصير عندنا these function. Number 1, phagocytosis of the particle. 2, intracellular destruction of the phagocytosed microbe and dead cell by a substance produced in the phagosome. Phagosome اللي هي عبارة عن vacuole containing the microorganism, including reactive oxygen and nitrogen species and lysosomal enzyme. 3, there will be liberation of substances that destroy the extracellular microbe and dead tissue, which are largely the same as the substance produced within the phagocytic vesicle. 4, production of mediators including arachidonic acid metabolites اللي راح نجي نشرحها and cytokines that amplify the inflammatory reaction by recruiting and activating more leukocytes. The functional responses that are most important for the destruction of the microbes and other offenders are phagocytosis and intracellular killing. Phagocytosis involve 3 sequential steps. Number 1, recognition and attachment of the particle to be ingested by the leukocyte. Number 2, engulfment with the subsequent formation of phagocytic vacuole. And 3, killing or degradation of the ingested material. These steps are triggered by activation of the phagocytes by microbes, necrotic debris, and various mediators. This is a figure showing how the phagocytosis takes place. Nitric oxide, it is a soluble gas that is produced by endothelial cells and macrophage and some neurons in the brain. Since the in vivo half-life of the nitric oxide is only seconds, the gas acts only on cells in close proximity to where it is produced. It is a potent vasodilator by virtue of its action on the vascular smooth muscle. In addition, it reduces platelet aggregation and adhesion and other inflammatory responses. Lysosomal constituent of the leukocyte, we have a neutrophil and monocytes. Macrophage contain lysosomal granules which when released may contribute to the inflammatory response. Oxygen-derived free radical may be released extracellularly from the leukocyte after exposure to microbes, chemokines, and other immune complexes. Superoxide anion, hydrogen peroxide, and hydroxyl radical are the major species produced within the cell. The physiological function of these reactive oxygen intermediate is to destroy the phagocytosed microbes. At a higher level, release of these potent mediator can damage the tissue. Serum, tissue fluid, and the host cell possess antioxidant mechanism that protect against these potentially harmful oxygen-derived radicals. Other functional response of the activated leukocyte, in addition to eliminating the microbe and dead cell, activated leukocyte play several other roles in the host defense. These cells, especially the macrophage, produce cytokine that can either amplify or limit the inflammatory reactions. Growth factor that stimulate the proliferation of the endothelial cell and fibroblast and the synthesis of collagen, and enzymes that remodel the connective tissue. All these are the products of the macrophage or the functions of the macrophage. Because of this activity, macrophage also have a central role in orchestrating a chronic inflammation and tissue repair after inflammation has subsided. Leukocyte-mediated tissue injury. The leukocytes are important mediator of injury to normal cell and tissue under several circumstances. يعني هي مو فقط important cells in the inflammatory process but also can produce tissue injury in these circumstances when the leukocyte as a part of normal defense reaction against infectious microbe when tissue at or near the site of infection suffer collateral damage. In some infections that are difficult to eradicate, such as the tuberculosis and certain viral disease such as hepatitis, the prolonged host response contribute more to the pathology than does the microbe itself. يعني بسبب the chronicity of the pathological condition, it will contribute to the damage more than the microbe itself. Number 2, when the inflammatory response is inappropriately directed against the host tissue, like in autoimmune disease. بعد when the host hyperreact against usually harmless environmental substance اللي هي تكون allergic to certain person, including in asthma and some drug reactions. Chemical mediators and regulators of inflammation. The mediators of inflammations are substances that initiate and regulate the inflammatory reaction. These may be produced locally by the cell at the site of inflammation or may be derived from circulating inactive precursors that are activated at the site of inflammation. The cell-derived mediator, these are rapidly released from intracellular granules, which are amines, or they are synthesized de novo like prostaglandin, leukotriene, cytokines in response to the stimulus. The major cell type that produce mediator of acute inflammation are tissue macrophage, dendritic cell, mast cell, but platelet, neutrophil, endothelial cell, and most epithelia also can induce to elaborate some of the mediators. So the cell-derived mediators are most important for the reaction against the offending agent in the tissue. Plasma-derived mediator, these are the complement protein, for example. These are present in the circulation in an inactive precursor that must be activated to be work, and usually by a series, the activation occur by series of proteolytic cleavage to acquire their biological properties. يعني احنا عندنا complement proteins, they should be activated they should be activated by a cleavage of the complement. يعني complement مثلا C3 يتقسم by the cleavage into C3A إلى C3B. These are the active component of the C3 يعني part or of the complement system or proteins. So they should be divided or proteolized in order to be activated by a proteolytic cleavage. They are produced mainly in the liver, the complement proteins, and are effective against circulating microbes and also can be recruited into the tissues. Most of the mediators are short-lived. They quickly decay or are inactivated by enzyme, or they are otherwise scavenged or inhibited when the function of them is finished. So there is a system of a check and balances that regulate the mediator action. يعني احنا we have to have a system for controlling the action of these mediators. One mediator can stimulate the release of other mediator. For instance, the products of complement activation stimulate the release of histamine, and the cytokine tumor necrosis factor act on the endothelial cell to stimulate the production of another cytokine, interleukin 1, and many chemokines. So one mediator acts to activate the production or the action of the another mediator. The secondary mediators may have the same action as the initial one, but may have a different and even opposite activity, thus providing mechanism for amplifying or in certain instances counteracting the initial action of the mediators. This is the schematic presentation or figure for the mediators of the inflammation. We have the cell-derived mediator اللي هي preformed, تقسم إلى preformed mediator in the secretory granules like the histamine and serotonin, واللي هي newly synthesized on need. يعني preformed اللي هي stored mediator in the granule, واللي هي synthesized newly on need اللي هي prostaglandin, leukotriene, platelet activating factor, reactive oxygen species, nitric oxide, cytokines, neuropeptides, all these. Well, we have the plasma protein اللي هي derived from the liver, synthesized from the liver, وتنطرح بالبلازما اللي هي complement system, والهاجمان factor اللي هو factor 12. All these are the mediators of inflammation وأنتم مطالبين بحفظها. This is the table showing the action of the principal mediators of inflammation, whether they are cell-derived or plasma protein, the source of them والأكشن مالتهم أيضا أنتم مطالبين به. هسه نجي number 1 اللي هي cell-derived mediator اللي هي vasoactive amine. قلنا they are stored، احنا حكينا قبل شوي بالفيجر ممكن تكون stored or synthesized on need. They are stored as a preformed molecule in the cell and are therefore among the first mediator to be released during inflammation. Once they are stored in the cell, so they are ready to be act. So when there is inflammation, they are rapidly released to the bloodstream from their store inside the cell. We have the histamine اللي هو it is the richest source of this amine is the mast cell. يطلع من الماست cell اللي هي included in this the action of histamine that are normally present in the connective tissue adjacent to the blood vessel. Also found in the basophil and the platelet. It causes شنو الأكشن مالته dilation of the arterioles and increased permeability of venules by binding to receptor on the endothelial cells. We have the serotonin اللي هو 5-hydroxytryptamine. It is present in the platelet and enterochromaffin cell. Also it has the action similar to those of histamine. We have the arachidonic acid metabolites اللي هي prostaglandin, leukotriene and lipoxin. On cell activation, arachidonic acid, which is a fatty acid, is released from the membrane phospholipid. يعني لما يصير activation للسيل الارachidonic acid هو موجود بالممبرين phospholipid membrane of the cell through the action of cellular phospholipase A2. هذا الانزيم يشتغل على الارachidonic acid اللي موجود بالفوسفوليبيد ويسوي له release. This enzyme is activated by mechanical, chemical, physical stimuli or other mediator اللي هي مثل ايش؟ مثل الكومبلمنت. احنا قلنا one mediator act on activation of other mediator. فالC5A اللي هو part of the complement system which is another mediators تشتغل to activate this enzyme phospholipase to act on the cell membrane phospholipid and release the arachidonic acid. Once it is free, arachidonic acid from the membrane, arachidonic acid is rapidly converted into bioactive mediator. فقط يتحرر رأسا يتحول إلى active form. This mediator أيضا نسميها eicosanoid. The arachidonic acid metabolites are synthesized by two major classes of enzyme اللي هي cyclooxygenase pathway و lipoxygenase pathway. الcyclooxygenase لما يعني طلع الارachidonic acid it will pass in two pathways يا اما cyclooxygenase pathway او lipoxygenase. الcyclooxygenase يعطينا generating البروستوغلاندين. من هي البروستوغلاندين؟ اللي هي ثرومبوكسين A2. واللايبوكسيجينيز باثواي جنريت اللوكوترين واللايبوكسينز وكل وحدة طبعا لها أكشن. So the prostaglandins these are produced by the mast cell. نرجع نقول origin مالتها الماكروفاج الانdothelial cell and many other cell type. كلها هذه الأراكيدونيك أسيد اللي موجود بال cell membrane لما يصير بي activation و release راح يعطينا بالend result prostaglandin and many other cell type, and they are involved in the vascular and systemic reaction of inflammation. They are generated by the action of two cyclooxygenase. عندنا two enzyme cyclooxygenase 1 و 2. The most important prostaglandin هو E2, D2, F2A و I2 sorry اللي هو نسميه prostacyclin والثرومبوكسين A2. prostaglandin طبعا كل واحد of these prostaglandins it have its يعني certain function. يعني عندنا prostaglandin D2 هو قلنا along with prostaglandin E2 they causes vasodilation and increase in the permeability of post-capillary venule, so they potentiating exudation and result in edema. D2 also is a chemoattractant for the neutrophils, so each one of them they have a specific function. Platelet contain the enzyme thromboxane synthase, which is responsible for the synthesizing thromboxane A2 اللي هو potent platelet aggregating agent and vasoconstrictor and thus promote thrombosis. Vascular endothelium contain prostacyclin synthase, which is responsible for formation of prostacyclin اللي هو prostaglandin I2. prostacyclin هو عبارة عن vasodilator and potent inhibitor of platelet aggregation. تلاحظون واحد يشتغل عكس الله، يعني الثرومبوكسين يشتغل على الثرومبوسيس والفازوكونستركشن، while prostaglandin I2 هو vasodilator inhibit platelet aggregation. So the action of this mediator can inhibit one another or can help one another, and thus it serves to prevent thrombus formation on the normal endothelial cell. In addition to their local effect, the prostaglandin are involved in the pathogenesis of pain, fever, and the two common systemic manifestation of inflammation. يعني احنا مثلا من اسألكم الفيفر اللي هي as a part of the manifestation systemic manifestation of inflammation اللي السبب مالتها هو البروستاغلاندين مثلا، والبين ايضا. So prostaglandin E2 make the skin hypersensitive to painful stimuli and cause fever during infection. طبعا هذه كلها انتم مسؤولين عنها وتشوفوها بالجداول اللي مذكورة بالكتاب وبالتوضيحات المشروحة. Leukotrienes. The leukotrienes are produced in leukocyte and mast cell by the action of lipoxygenase pathway and are involved in the vascular and smooth muscle reactions and leukocyte recruitment. هذا الفانكشن مالتها. The synthesis of leukotriene involve multiple steps, the first of which was generating leukotriene A4. طبعا in turn it will give leukotriene B4 or C4. The leukotriene B4 produced by neutrophil and some macrophage and is a potent chemoattractant agent and activator of a neutrophil. It will cause aggregation and adhesion of the cell to the venular endothelium, generating reactive oxygen species and release of the lysosomal enzymes. The cystenyl containing leukotriene اللي هو leukotriene C4 and its metabolites leukotriene D4 و E4 are produced mainly in the mast cell and cause intense vasoconstriction, bronchospasm اللي هو very important in asthma, and increase permeability of the venule. طبعا احنا مثلا نقول bronchospasm اللي هو الكوز مالته هو leukotriene C4. This is very important to be targeted in the treatment of asthma مثلا حتى نوخر bronchospasm. Lipoxenes also are generated from arachidonic acid by lipoxygenase pathway. They suppress inflammation by inhibiting the recruitment of leukocyte. طبعا in every mechanism in the body or in every process we have a stimulator factor and we have inhibitory factor. فهنا اللايبوكسين تشتغل as inhibiting for the recruitment of the leukocyte. They inhibit neutrophil chemotaxis and adhesion to endothelium. They are unusual in that two cell populations are required for transcellular biosynthesis of these mediators. Leukocytes, particularly the neutrophil, produce intermediates in lipoxene synthesis, and these are converted to lipoxenes by platelet interacting with the leukocytes. Now we come to the cytokines and chemokines. The cytokines, these are protein produced mainly produced by activated lymphocytes and macrophage and dendritic cell, but also endothelial, epithelial, connective tissue cell that mediate and regulate immune and inflammatory reaction. In addition to being involved in cellular immune response, they also play important role in both acute and chronic inflammation. Those relevant to inflammatory response include the tumor necrosis factor, interleukin-1, which are the major cytokines that mediate inflammation. Tumor necrosis factor and interleukin-1 can be stimulated by endotoxin and other microbial products, immune complexes, and physical injury. The most important role of them or of these cytokines are endothelial activation of leukocyte and other cell, systemic acute phase response اللي راح نجي نحكي عليه بعد شوية, والtumor necrosis factor regulate energy balance by promoting lipid and protein catabolism and by suppressing the appetite. The chemokines, these are a family of small protein that are act primarily as a chemoattractant. موضح عندكم بالصورة اللي راودكم إياها بالبداية على the process of inflammation. For a specific type of leukocyte, for example, عندنا الانترلوكين 8 act on the neutrophil اللي هو بالacute inflammation. The chemokines bind to proteoglycan and are displayed at a high concentration on the surface of endothelial cell and in the extracellular matrix. They have two main functions, بالacute inflammation and maintenance of the tissue architecture. This is the figure اللي هو يراوينا يعني major role of cytokine in acute inflammation. هذا تشوفوه وتطلعون عليه. Plasma protein, these are belong to three interrelated systems, the complement, the kinin, and the clothing system. The complement system, اللي هو the major part of our discussion, is a collection of soluble protein and their membrane receptor that function mainly in the host defense against microbes and pathological inflammatory reactions. The complement protein are present in inactive form in the plasma, and many of them are activated to become proteolytic enzyme that degrade other complement protein. So they forming an enzymatic cascade يعني سلسلة من الانزيمات capable of tremendous amplification, تقدر تتضاعف بكثرة شديدة بسبب تكرار الانقسام. The critical step in the complement activation is the proteolysis of the third اللي هو الثالث, البروتين الثالث. The third and the most abundant اللي موجود بأكثر كثافة الكومبوننت اللي هو C3. So cleavage of the C3 occur by one of three pathways. يا إما عندنا classical pathway triggered by fixation of C1 to antibody اللي هو either immunoglobulin G or M that has combined with the antigen, يعني يجي antibody antigen complex ويقعد عليه C1 والC1 يسبب لنا after it's fixed to the antibody antigen complex يسوي لنا cleavage of the C3. Or this is the classical pathway. Or we have the alternative pathway اللي هو triggered by microbial surface molecule اللي هو الانdotoxin نعتبره, complex polysaccharides اللي هي موجودة على الميكروب and other substances in the absence of the antibody. بهالحالة ما عندنا antibody. هذا الالternative pathway. أو عندنا the lectin pathway اللي هو plasma mannose binding lectin bind to the carbohydrate on the microbe and directly activate C1 اللي هو subsequently will activate C3. All three pathways of complement activation lead to formation بالنهاية of an enzyme نسميه C3 convertase اللي هو split C3 into two functional distinct fragments C3A and C3B. In the process of complement activation, a number of complement components are elaborated to mediate a variety of phenomena in acute inflammation. We have the vascular phenomena اللي هي involved in it C3A, C5A. They stimulate histamine release from the mast cell and so increase vascular permeability ويسوي لنا vasodilation. الشغل مال كيمو اتراكتنت اللي هو C5A is a powerful chemotactic agent for the neutrophil, monocyte, eosinophil, basophil. أوبسونين الأوبسونين اللي هو نقصد به إنه تجي complement attach on the surface of the microorganism and make it valid for phagocytosis. الأوبسونين اللي هو particle formed by هو microorganism covered by the complement protein. فتخلي هذا الميكروأورجانيزم هو accessible for the macrophage to get phagocytosis. تشتغل as opsonine when fixed to the bacterial wall اللي هي C3B, act as an opsonine and favor phagocytosis by neutrophil and macrophage. The plasma protein continue. We have the kinase system. Initial activation of kinase system is through the action of factor 12A on the precalcarine اللي هو lead to formation of calcarine. This occur following exposure of the blood plasma to vascular basement membrane collagen after injury to endothelial cell. يعني لما يصير عندنا endothelial cell injury اللي راح يصير basement membrane under the endothelial cell, it will be exposed to the blood plasma. بهالحالة الكاينين system راح يتحفز. The calcarine has a chemotactic activity and directly converts C5 to the chemoattractant C5A. One of the important kinine is the vasoactive bradykinin أيضا مهم. البراديكاينين increase also vascular permeability ويسوي لنا contraction of smooth muscle, dilation of blood vessel and pain when injected into the skin. These effects are similar to those of histamine. Okay, C, we have the clotting system. Activation of the clotting system result in the formation of thrombin النهاية مالته و formation of the thrombin mesh. The thrombin generate insoluble fibrin clot. يعني هو الثرومبين راح يكون لنا fibrin clot اللي هي insoluble. It also bind to specific receptor expressed on platelet, endothelial and smooth muscle cell triggering the recruitment of leukocytes. هذا التيبل يراوينا role of mediator in different reaction of inflammation. الفازودايليشن من يسويها increase vascular permeability, الكيموتاكسيس, الفيفر, البين, الtissue damage. This is very important table. Now we come to the morphological pattern of acute inflammation. The hallmark of acute inflammatory reaction هو dilation قلنا of small blood vessels and accumulation of leukocyte and fluid in the extravascular tissue. The vascular and cellular reactions account for the signs and symptoms of the inflammatory response. يعني هي the signs and symptoms of inflammation كلها are caused by these vascular and cellular reactions. The first type morphological pattern of acute inflammation هو serous inflammation, which is marked by the exudation of cell pour fluid into the space. يعني الفلويد اللي راح يتجمع هو pour in the cell ما بي خلايا كثيرة by injury to the surface epithelia or into the body cavity lined by peritoneum, pleura or pericardia. Typically the fluid in serous inflammation not infected by destructive organism and does not contain large number of leukocytes اللي هو موجود بالpurulent inflammation. In the body cavity the fluid may be derived from the plasma يترشح من البلازما as a result of increased vascular permeability or from the secretion of the mesothelial cell which lining the body cavity, others as a result of local irritation. Accumulation of the fluid in these cavities is نسميه الافfusion. The effusion consisting من يش متكون of transudate which is a low protein content fluid also occur in non-inflammatory condition مثل reduced blood outflow in the heart failure or reduce plasma protein level in some kidney or liver disease. All these will increase the hydrostatic pressure inside the blood vessel and lead to the effusion of the fluid from intravascular to the extravascular space. We have a skin blister resulting from a burn or viral infection represent accumulation of serous fluid. These are an example of serous inflammation اللي هي skin blister هو viral infection within or intermediately beneath the damaged epidermis of the skin. هنا عندكم the two examples. On the left side is the serous inflammation. This is a low power view of a cross section in the skin blister. يراوينا epidermis separated from the dermis by a focal collection of serous fluid. طبعا هذا الفلويد هو يبين هنا transparent اللي هو ما بين epidermis above والdermis below. تشوفون space أبيض هذا هو السبيس اللي هو containing the transudate اللي يسوي لنا البلستر. So this is an example of serous inflammation. In the right side, this is a serous inflammation of the serous pleural effusion, excessive accumulation of a clear thin fluid low in protein in the pleural cavity. طبعا هذا in the lung. تلاحظون هذا الشادو الشايني شادو اللي pointed by the arrow هذا هو يراوينا السبيس اللي هو filled with fluid. وهذه التشو الصغيرة اللي هي in the center هذه هي shrinked lung. هاي اللنج هي المتبقية بسبب ال pressure of the effusion on the lung. It is transparent, but note the reflection of light in the upper part of the photograph and lung will be collapsed. الأرو عليها هي collapsed lung due to the pressure induced by the fluid. Fibrinous inflammation. It is fibrinous exudate develop when the vascular leak are large or there is a local procoagulant stimulus within a large or with a large increase in the vascular permeability. So the higher molecular weight يعني proteins will such as fibrinogen will pass out of the blood and fibrin is formed and deposited in the extracellular space. The fibrinous exudate is characteristic of inflammation in the lining of the body cavities such as meninges, pericardium, and the pleura. Histologically, fibrin appear as an eosinophilic meshwork or of threads or sometimes as an amorphous coagulum. The fibrinous exudate may be dissolved by fibrinolytic and fibrinolysis or fibrinolytic effect and cleared by the macrophage. If the fibrin is not removed with time, it may stimulate ingrowth of fibroblasts inside the fibrin mesh and blood vessel, so it will lead to formation of scarring. Conversion of fibrinous exudate to scar tissue هذا نسميه organization within the pericardial sac lead to opaque fibrous thickening of the pericardium and epicardium in the area of exudate, and if the fibrosis is very extensive طبعا obliteration of the pericardial space will occur. هذا هو البريكارديوم fibrinous exudate, a deposit of fibrin on the pericardium. All these purple dots هي الفibrin deposit on the pericardium. وهنا طبعا on the right side اللي هو histological section showing a pink meshwork of fibrin exudate. هذا F اللي هو pointed by F, and this will overlie the pericardial space اللي هو المؤشر ب letter P. الفايبرين طبعا احنا من نجي نصبغه it is a proteinaceous material يظهر ياخذ الصبغة الحمراء of eosin. الهيماتوكسيلين تصبغ لنا النيوكليوس ازرق، والايوسين هي الصبغة الحمراء اللي تصبغ لنا البروتينيشيوس ماتيريال. لذلك on the cross section الفايبرين يظهر باللون البيربل dark purple. The purulent inflammation أو suppurative inflammation أو بعض الأحيان نقول abscess. Purulent inflammation is characterized by the production of a pus اللي هو an exudate consisting of a neutrophil, liquefied debris of necrotic cell and edematous fluid. The most frequent cause of purulent inflammation هو الانفكشن with bacteria اللي يسوي لنا liquefactive tissue necrosis مثل staphylococcus. These pathogens are referred to as a pyogenic pus-producing bacteria. A common example of acute suppurative inflammation هو acute appendicitis. الabscess, these are localized collection of pus caused by suppuration buried in a tissue or an organ, or it is confined space. They are produced by seeding of pyogenic bacteria into the tissue. Abscesses have a central region that appear as a mass of necrotic leukocyte and tissue cell. There is usually a zone of preserved neutrophil طبعا داير مدايرها around this necrotic focus, and outside this region there may be a vascular dilation, parenchymal and fibroblastic proliferation indicating chronic inflammation and repair. يعني البودي يحاول يسوي repairing to this process or this damage. In time the abscess may become walled off, تغلف, and ultimately replaced by connective tissue. When persistent or at a critical location مثلا بالbrain, the abscess may have to be drained surgically because the brain is very critical organ and it may cause a pressure. This abscess, if it is large or it cause a heavy damage, they may cause the patient may be unconscious or may have a serious systemic signs and symptoms, so they have to be drained. And this is the purulent inflammation with abscess formation. تلاحظون هنا multiple bacterial abscess in the lung pointed in the arrow. They are yellow to white, a collection within the parenchyma of the lung in case this is of bronchopneumonia. On the right side is the histological section showing the debris and the collection of the necrotic material in the center, surrounded by the inflammatory cell infiltration, and many dilated blood vessels appear here, reddish dilated blood vessels surrounded the focus of the inflammation. The ulcer is a local defect or excavation. Excavation يعني مثل الحفرة of the surface of an organ or tissue that is produced by necrosis of the cell and sloughing, shedding of the necrotic and inflammatory tissue. Ulceration can occur only when the tissue necrosis and resultant inflammation exist on or near a surface. يعني احنا ما يصير عندنا الألسر إذا ما عندنا surface exposed. So the ulceration is always involving the surface area, like the surface of the stomach, or ممكن duodenal ulcer, mouth, on the mouth اللي هي الأفثس ulcer, any surface in the body, in the conjunctiva, if there is shedding of the cell, necrosis and shedding of the cell, it will create a cavitation or excavation, and this is called an ulcer. Ulceration are best exemplified by peptic ulcer of the stomach or the duodenum, in which acute and chronic inflammation coexist at the same time. طبعا لأن الألسر هو يبدي acute ممكن يتحول إلى chronic. During the acute stage there is intense polymorphic nuclear infiltration اللي هي leukocyte and vascular dilation in the margin of the defect. With the chronicity, the margin and the base of the ulcer develop scarring and fibrous tissue formation with the accumulation of lymphocyte, macrophage and the plasma cells. هذا هو الألسر. هذا الأبر بارت هو الكرونيك duodenal ulcer, gross appearance. lower part هو البي اللي هو lower power cross section of duodenal ulcer crater. طبعا هاي الحفرة مال الألسر احنا نسميها crater, ulcer crater with an acute inflammatory exudate in the base. هذا كل الوردي هو inflammatory in the base of the ulcer, هو inflammatory exudate. What is the outcome of acute inflammation? In general, the acute inflammation may have one of three outcomes. يا إما يصير عندنا complete resolution if the injury is limited or short-lived, or there has been a little tissue destruction, or the damage of the parenchymal cell can regenerate. يعني شنو؟ يعني a type of the cell that are capable to regenerate and divide. Healing by fibrosis after extensive tissue destruction, ممكن يصير fibrosis, or when the inflammatory injury involves tissue that are incapable of regeneration, or when there is abundant fibrin exudation. The progression to chronic inflammation ممكن اللي هو third out يعني fade اللي هو acute to chronic transition occur when acute inflammatory response persists for a long time, either due to preservation of the injurious agent, يظل الانجurious agent موجود, or persistent, or due to some interference with the normal process of healing. مثلا عندنا deprivation in the food, nutrient, blood supply قليل, مثلا diabetic patient, So الacute inflammation ممكن أن يتحول إلى chronic inflammation. This figure showing the outcome of acute inflammation. We have the systemic effect of inflammation. We have the acute phase response consisting of several clinical and pathological changes. اللي هي the most important fever is a prominent manifestation produced مثل ما قلنا in response to pyrogene that act by stimulating prostaglandin synthesis in the vascular and peripheral or perivascular cell of the hypothalamus. Acute phase protein are plasma protein اللي synthesized in the liver and whose plasma concentration may increase several hundreds during inflammation. The best known of these was C-reactive protein. Elevated serum level of this protein are used as a marker for increased risk of myocardial infarction in patients with atherosclerotic coronary artery disease. Also, as you all know, in coronavirus crisis, also C-reactive protein was shooting and its levels are very, very, very high. Fibrinogen, the rise in fibrinogen cause erythrocyte to form a stack or rolex, يعني مثل الرولة, that sediment more rapidly than individual erythrocyte. So this is the basis for the elevation of erythrocyte sedimentation rate. Important also, serum amyloid protein, A protein, prolonged production of this protein cause secondary amyloidosis and destructive chronic inflammation, اللي هو rheumatoid arthritis. So it is very important. Leukocytosis is a common feature of acute phase response, especially those induced by bacterial infection. Leukocytosis occur initially because of accelerated release of these cells from the bone marrow reserve pool, اللي هي الكوز مالتها طبعا هو السيتوكين including interleukin 1 and tumor necrosis factor, which is the most involved cytokines in the acute inflammation and is therefore associated with rise in the number of more immature neutrophil. راح تخرج من البون marrow the more immature neutrophil in the blood, فهذا راح نسميه shifting to the left. Most bacterial infection induce neutrophilia اللي هي زيادة النيوتروفيل in the blood, while viral infection اللي هي like infectious mononucleosis, mumps, German measles produce leukocytosis due to absolute lymphocytosis. In bronchial asthma, hay fever, and parasitic infection, there is an absolute increase in the number of eosinophils, creating an eosinophilia. So you can know viral infection cause lymphocytosis, البرونكيال asthma تسوي لنا eosinophilia, bacterial infection تسوي لنا leukocytosis اللي هو يعني neutrophilia. All these are manifestation of leukocytosis for each type of infection. Certain infection مثلا typhoid fever and infection caused by viruses, rickettsia and certain protozoa are associated with decreased number of circulating white cell اللي نسميها leukopenia. Other manifestation of acute phase response will increase in the pulse and blood pressure, decreased sweating, rigor and anorexia. 5 disseminated intravascular coagulation DIC and septic shock. طبعا هذا اللي يصير بالسيفير bacterial infection اللي هو sepsis. A large amount of organism and lipopolysaccharide in the blood stimulate the production of a large amount of tumor necrosis factor and interleukin 1. High level of tumor necrosis factor causing DIC or disseminated intravascular coagulation. Lipoproteins or lipopolysaccharides and tumor necrosis factor, both of them induce tissue factor expression on the endothelial cell اللي هي initiate coagulation. راح يبدي يصير عندنا intravascular coagulation. The same agent inhibit natural anticoagulant mechanism. Thank you very much.